Good evening. My name is Shikeeyna Pope, and today I will be talking to you all about probiotic and symbiotic supplementation to see what impact they have on obesity related anthropometric metabolic parameters and sedentary individuals clinically diagnosed with obesity. So, as we know, obesity has been on the rise in the last few years. So, in 2016, 650 million individuals were obese. And then, if the trend continues, 1.12 billion individuals will be diagnosed with obesity by 2030. So, those are very alarming numbers. And so, with those alarming numbers, it has kind of given individuals in the nutrition and the medical field, kind of given them the responsibility that more research and more interventions have to be discovered and employed to really just combat obesity and the negative effects that it has on our families and also on our communities as well. So research has shown that the gut microbiome and obesity are related. And so the role of that gut microbiota is energy metabolism, fat storage, short chain fatty acid production, vitamin synthesis, brain function. It's even research has shown that it has an influence on the nervous system as well. And so what they have seen in individuals with obesity, you have abnormal energy metabolism, you have abnormal fat storage, and then so that is kind of one of the connections that they're making between the gut microbiome and obesity, is that some of the roles that the gut microbiome have 100% play a part in obesity manifestation in people. And so dysbiosis is basically an imbalance of that gut microbiome. And so what they have seen is that individuals with obesity tend to have an imbalance of the gut microbiome. They're also seeing that weight loss interventions can trigger that dysbiosis as well. So some of the more traditional weight loss interventions that we employ are pharmaceuticals. We employ low carbohydrate diets. We also employ, the exercise. We employ bariatric service and so surgery. And so all of those have some impact on the gut microbiome as well. And so that is another connection that they are making with obesity and the gut microbiome and how obesity triggers to dysbiosis, but then also the gut microbiome in individuals with obesity is altered, and that contributes to dysbiosis. So it's a big circle. And so that kind of brings the conversation to more innovative ways to combat weight loss. So probiotics and symbiotics have been used in research looking at improvement in the gut microbiome. So now research is looking at not necessarily just the improvement, but also that improvement of the gut microbiome in conjunction with weight loss. And so for this literature review, adult men between the ages of 18 and 65 with a BMI over 25 was observed, and also they had to have some kind of implementation of probiotic symbiotic supplementation for at least 2 months. So some of the exclusion criteria were just diseases or medications or lifestyle factors that would really impact that gut microbiome. So that could be medicine, as far as antibiotics, diabetes, kidney disease, any type of gastrointestinal disease, those individuals were excluded. So what results showed was out of the 6 studies that symbiotic and probiotic supplementation did have a positive impact on some of these parameters. So you saw an increase in body weight, a decrease in fat loss, a decrease in BMI, a decrease in an improvement in LDL levels. You saw an increase in triglycerides. You saw an increase or alteration in that waist and hip circumference as well. So one study did see the levels of the LDL-C improvement. There were no improvements in blood pressure or HDL-C levels throughout the studies. And then one study, ironically, observed HbA1c improvement, but didn't observe any body parameters. And so what these studies, some of the strengths I saw overall were just the length of the interventions, the inclusion criteria was a strength, and the exclusion criteria was a strength as well. The probiotic and symbiotic strains were administered alone just to kind of deviate from that pharmaceutical interaction that medicines can have. And then a lot of these studies were done in a real life setting. So individuals came in, took their supplementation, and then they carried on with their normal lives. And so a lot of the methods of the studies were very similar. And then another thing that was a strength were the different variables. And I'll talk about, I'll move into the limitations as well with this one, because I listed the different variables as a strength and a limitation just because I thought it was a strength that you saw that it is so many different factors and parameters that contribute to obesity or overweight diagnosis in an individual. But then you also saw that negative aspect of having those outcomes it was just hard consistently to compare the studies when you're really just looking at whether it's an improvement or whether it's not. So another limitation of the study was the one study that implemented that low carbohydrate diet. And as I mentioned earlier, that can really negatively impact the gut microbiome. Some of the studies were approaching significance, so they were just a couple numbers off and didn't reach that. So that was a limitation because it didn't show that some of these studies, some of these outcomes were significant, but were almost significant, or you saw improvements, it just didn't reach significance, if that makes sense. A limitation was the different probiotic, symbiotic compounds, and not just the different compounds, but also the different dosages as well, and how they were delivered as well. I will say majority of the studies had them delivered in pill form, but one study I can remember off the bat did deliver it within a smoothie. And then clinical weight loss. So like I said about the studies or the outcomes that approach significance, with that clinical weight loss, if it didn't meet that minimum of 5% deduction from that baseline measurement, then it kind of was just looked at as it wasn't a success. So really the clinical weight loss could have been a hindering factor on some of these outcomes. Majority of the studies was women, so hormones could have played a part, not necessarily just hormones, but then you also talk about just the different body and genetic makeups compared to men and women. The studies were specific to ethnicity, but that kind of just shows that it worked in this particular environment with this particular type of people. As we know, obesity is multifaceted. It affects various people from different socioeconomic statuses, from different ethnicities. So really, for these studies moving forward, we need them to be inclusive of all individuals, of all colors, of all sizes, of all geographic locations, to really try to understand this issue and see how we can get some of these prevalence numbers down in obesity. And then overall, the gut microbiome is a fairly new topic. And then integrating the gut microbiome in obesity is even newer. So we do know probiotics and symbiotics have an improvement on the gut microbiome. And although in this study we did see that those supplementations did have an improvement on obesity-related parameters, more research needs to be done, just because this type of research is in the preliminary stages, and obesity is multifaceted. The gut microbiome is multifaceted. People, we are multifaceted. So it just shows that more research needs to be done in various settings, various time periods in different populations to really kind of understand the effect it has on obesity, and then also to come up with some solutions. And thank you.